Hey everyone, me Kevin here. Joe Biden is now expected to be our next president, and in this video I'm going to break down what Joe Biden's COVID response plan looks like. Some have called this plan radical, and what we're going to do is we're going to look at exactly what to expect. Is it lockdowns, or what could we possibly expect? First, Joe Biden is expected to announce a 12-person coronavirus task force this Monday. This will be the first announcement prior to making any cabinet picks that Joe Biden makes, which signals how important the coronavirus pandemic is to Joe Biden. I'm going to break down what members of this task force have already stated. We have some of the names already. But first, we're going to react to a very powerful video that breaks down Joe Biden's exact plan. Now, just a fair trigger warning. This video does say some not so nice things about Donald Trump, but the point of playing this video isn't to try to play partisan favorites. It's simply to show us what we should expect in terms of a Joe Biden administration and a COVID plan. Are we expecting lockdowns, or what should we expect? I'm only playing this to help you understand these things, and I highly encourage you to watch all of this video, and if you found it helpful, please consider sharing it. Let's go ahead and get the video up. Just a quick note, I have released the highest coupon code we have ever had for the amazing programs linked down below. It's the Black Friday month coupon code. Check it out down below, and it is a great deal for the real estate courses, the courses on property management, sales, stocks, YouTube videos, anything you like, it's down there. Making money from home, you name it. Look forward to seeing you in those programs. Okay, let's hop now over to what this video says. And again, the first part is a recap on what's been going on, and it doesn't play favorites, but then we're going to get into the plan. Let's get started.
Hi, I'm Ron Klain, former White House Ebola Response Coordinator. 4 months ago, I made this video warning that the Trump administration's response to COVID was going off the tracks. At the time, people said it was alarmist. Fewer than 20 Americans had died from coronavirus. Now, 4 months later, we're nearing 140,000 American deaths.
Keep in mind, this initial recap was filmed in July, but this is still very important because it tells us what Biden's plan is going to be. It's a very, very good video in terms of giving us a full overview, and I'll add commentary as necessary.
The Trump administration response to this crisis has clearly failed. And the questions I get most often now are, what would Joe Biden have done differently at every step along the way? And most importantly, what would he do now to stop the coronavirus epidemic? Let's break it down.
Very important.
Before I get into the Joe Biden plan to fight COVID, let's go step by step as to how we got to where we are now. Back in March, when the crisis was really accelerating, and healthcare workers were desperate for masks, gloves, and gowns to protect themselves as they were fighting the disease, Joe Biden proposed using all presidential powers to ramp up the production of that vital gear, including using the Defense Production Act. What did Donald Trump do? He implied that our healthcare workers lacked the gear they needed because they were stealing it. Listen to what Donald Trump said.
And I'm going to make a quick note. It is very important that we use the Defense Production Act, especially for masks. Quality masks, too, not the flimsy cloth ones you get off Etsy that fall off your face.
The masks going? Are they going out the back door?
Then, in April, as the epidemic grew, the lack of testing was having the disease get out of control. Now, Joe Biden proposed a pandemic testing board to deliver on Trump's broken promise that every American who needed a test could get one. What did Donald Trump do? He said that people should fight the disease by injecting themselves with disinfectant. Really, that's what he said.
Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection?
Donald Trump has come out later and said that he was clearly joking with the commentary that he made.
April and on into May, experts said we could slow the spread of the disease if we wore masks around other people. What did Donald Trump do? He refused to wear a mask. He divided the country by attacking people who were wearing masks. Joe Biden, he led by example. In June, Joe Biden, advised by experts, offered a detailed plan on how to open our businesses safely to protect workers and consumers. Donald Trump, he led a chaotic reopening, praising local officials who ignored his own experts, putting our health and our economy at risk.
One thing that has been extremely complicated is that you do have governors doing different things. You have local mayors doing different things. It's almost impossible to know what are the COVID restrictions in this county versus that county. Are restaurants open here or they closed? Are schools open here or they closed? Are gyms open here or closed? It's a mess, and it's still a mess today, and it is November 7th. But we're going to get into the plan, which is so much more important now that we know Biden's going to be president. Subject to, lawsuits not working out.
Now it's July. Nearly 140,000 Americans are dead. Trump's
We're now almost 230,000.
response has failed. What's the best evidence for that? Well, look at this chart. Back in March, the United States and Europe were facing similar COVID crises. Since then, Europe has gotten the disease under control. But
This is obviously problematic now looking at this in November because it's like, Europe's doing pretty bad right now. But we are also doing really bad, right? So it's kind of like, if we expand this chart, Europe was all the way down. We slowly started going down. Things got really, we had our summer bump in June, and then things slowed down again in August and September. But now we are skyrocketing just like Europe is. So we'll let this sort of comment here pass, and let's get to the plan.
in the U.S., cases are still going up. We're at the worst levels of COVID ever. So why is it worse here in America? Because Donald Trump has waved the white flag in the fight against coronavirus.
And again, I told you this was going to be partisan and they were going to slam Trump. And they start the plan talk within the next 20 seconds.
So that's how we got to where we are. Now, let's look at the Biden plan for fighting coronavirus. At the time we're taping this video, it's been weeks since Donald Trump spoke to the nation's leading infectious disease expert, Dr. Tony Fauci. Joe Biden has said his first phone call when he gets elected president will be to Dr. Fauci. He's got a detailed plan. You can read it on his website, joebiden.com. Here are 6 highlights. The Biden plan starts with fixing Trump's testing fiasco. He'd make sure that all Americans have access to regular, reliable, and free testing.
That's actually very interesting. We do not have that right now. We don't have regular testing available. I mean, there are rapid tests you can go take, but you're paying, sometimes for a rapid test, you're paying as much as $150 for a test, sometimes even more. If you have to regularly get these tests, I mean, this is a substantial burden. And sometimes the rapid tests aren't even extremely accurate yet. It just creates some other problems and the need for more testing. Testing's expensive right now. It's not too readily available. I mean, it's available if you got the money for it.
He'd double the number of drive-through tests, and he'd hire 100,000 or more contact tracers to make sure we're finding cases of the disease.
At this point, I will say we're probably too late for contact tracing, so I would expect that, yes, doubling up on testing is not a bad idea. It's better that we know where the cases are than have those tests go unnoticed or those cases go unnoticed. Contact tracing, at the stage we are in now, probably hope has been lost. At this point, you look at a country like Germany, the vast majority of their cases have absolutely no idea where they got COVID from, and contact tracing is essentially impossible because too many people have it. And that's Germany, and Europe is having this issue. They're about 2 weeks ahead of us. We're not looking good. We're on a bad trajectory right now.
He'd launch a national strategy to acquire, produce, and distribute protective gear, PPE, to protect our frontline workers.
Now, this is something where Donald Trump was on it when it came to ventilators. Ventilators, Donald Trump, in fairness, was on it in getting these ventilators manufactured and getting them, distributed to hospitals and areas of need. But in terms of masks and PPE, personal protective equipment, N95 respirators, we are miserably failing. And I'm not trying to blame Donald Trump here for that. I'm just saying we do not have a national mask distribution plan. And keep this in mind, I'm not talking about the little funky cloth ones. Any of the cloth masks, like the ones you get off Etsy, 10 to 20% effectiveness. Very, very low. The mask that, this gentleman walked out with, maybe 30 to 40% effective. Level 3 surgical mask, 60% effective. N95 respirator is 90 to 95% effective. Very, very powerful. You put on a P100, that's nearly 100% effective. It's incredible. Now, obviously, they have to be worn correctly, right? That's why we say nearly in the effectiveness. But yeah, the overall higher quality masks, very, very important. That's one of the reasons we have such a divided country where we have so many of us saying masks suck. Well, you're not wrong. The sucky masks do suck. And most people have sucky masks. It's a problem.
Use his full authority under the Defense Production Act to make sure we have enough of this vital equipment. And he'd focus on producing more of it here in the United States. It'd create jobs for American workers, and it'd make us less vulnerable to foreign supply chain disruption.
Nice.
Third, he'd accelerate the development of vaccines and treatments for COVID. And he'd deploy a smart plan for distributing that vaccine, because discovering a vaccine isn't enough if it gets distributed in the same kind of fiasco as Trump's testing mess. Fourth, while Donald Trump has said he's going to take the United States out of the World Health Organization, Joe Biden would restore our ties to the WHO, because you can't fight a global pandemic without a global approach and allies. That's the best way to keep Americans safe. Fifth, Joe Biden has a plan to safely reopen our businesses. This includes working with governors and mayors to require masks, and it means getting our workers the gear they need and the tests they need to be safe on the job. Sixth, Joe Biden would protect older Americans and those at higher risk. That means enforcing federal rules to protect nursing home patients, and it means testing for those in the highest risk groups. It also means special steps to make sure we're fighting the disease among our black and brown populations. So that's what Joe Biden will do to fight coronavirus. What can you do? Well, stay home when possible, and when you have to go out, practice social distancing. Wash your hands frequently, at least 20 seconds, with warm water and soap. And wear a mask when you're around other people. It's one of the best ways we can fight transmission of the disease. So choose wisely and stay safe.
I do wish there was more talk about the effectiveness of particular varieties of masks. You know, masks are not created equal. But let's now move on to see what 7 former FDA commissioners, including Dr. Scott Gottlieb, said to the Washington Post. On September 29th, this group of 7 mentioned, and by the way, this group of 7 does include David Kessler, who is one of the individuals that is going to be on Biden's task force. And the letter stated the following: a vaccine is urgently needed to reduce the health impacts of the virus and help Americans return to normalcy. But a safe and effective vaccine will not be enough. People will also have to choose to take it. They then go on to say that the White House, under Trump, quote, might try to influence scientific standards for vaccine approval. The commissioners complain that the FDA's communications have been politically manipulated, and that significant misstatements have been made, and that science is not driving testing anymore. Now, 78% of Americans, according to Pew Research, express concerns over a vaccine that is hastily approved. If the FDA makes available a safe and effective vaccine that the people trust, we could expect to meaningfully reduce COVID risk as soon as next spring or summer. Without trust, our health and economy could lag for years. That's a quote from the letter. Scientists should make decisions based on data, unfettered by political pressure or the intrusions of ideology or vested interests. Additionally, that was the letter. Additionally, we have another member, Surgeon Vivek Murthy. This is an individual who has spoken numerous times about COVID, and here are some quotes from him, and expect all of these individuals to come together to see what we should expect in terms of a full-on response. He says, quote, much of this was preventable. Quote, we can still avoid more tragedy, but it will require our government to finally step up and mount the response that COVID-19 has demanded. Vivek calls for science to drive vaccines and treatments, not politics. Vivek says the FDA will not be rushed and should not be rushed to approve treatments and vaccines. In fact, he says that speed is important, but safety is more important. He also says that 1, masks are a low-cost lifesaver. Again, I wish we had the specificity of what kind of mask to use. 2, we need universal mask mandates. 3, our government should be making billions of good quality masks for the public. They are a best buy. Vivek also suggests staying home when possible. So what do we have here? We have the following. a national plan that requires social distancing, a national mask requirement, anything that would keep community spread low, the potential for the Defense Production Act to immediately produce high quality masks for everyone, not the cheap crap masks that we use now that don't work. We also haven't noticed any talk about lockdowns yet in this plan. So far, only Dr. Scott Gottlieb has teased the lockdowns, and Dr. Tom Frieden, who did work under the Biden-Obama administration between 2009 and 2017, have encouraged Irish-style lockdowns, but we have not seen any individual on this coming task force recommend lockdowns. So, this is what we know so far on Joe Biden's coronavirus plan. If you found this helpful, please consider subscribing. Remember that you can still get 3 free stocks with Webull via the link down below. Deposit $100, they give you 3 free stocks, and of course get life insurance in as little as 5 minutes via the link down below. You don't have to talk to anybody, and you can Apple Pay and Android Pay for it. Also check out that new Black Friday coupon, and folks, we'll see you soon.